Hi everyone, this is Susie from Surrey Total Health. I'm the practice manager here, and during this time of the coronavirus, we are keen to offer you support. Today I've got Mr. Unithan, our consultant orthopedic surgeon, and John Cook, our lead physiotherapist at the Body Mechanics. So I'm just going to kick off by asking a few questions. We are talking about hip pain due to arthritis today. Mr. Unithan, due to the COVID situation, are less people attending hospital?
Suji, that's a very good question. Thank you for inviting me. Yes, all operations of elective hip and elective orthopedic surgery at the present is stopped. Normally, I'll be seeing about 20 patients weekly and operating on 4 to 5 hip or knee replacements. That's all stopped. We don't know exactly when that will start. The only operations I'm performing now are life and death threatening conditions, and hence the number of patients who are coming from chronic conditions have certainly decreased, and all what we are offering them at the moment is telephonic conversations and advice.
Okay, so what happens to patients with chronic conditions like hip pain?
Good point. So I'm just going to briefly run you through one topic. Hip pain as such is a very big topic, and it has got lots of conditions. So let's stick to hip pain due to arthritis. Arthritis as such just simply means inflammation of the joint. The majority of the arthritis I see are osteoarthritis or rheumatoid arthritis. There are a number of other forms of arthritis, but this is the most common forms of arthritis. Now, osteoarthritis is very different to osteoporosis. We can talk about it later. So the arthritis that mainly affects our weight-bearing joints like hips, knees, spines, foot and ankle, shoulders. It also affects other joints, but the hip and knee and spine problems are what majority are presented as pain. So the majority of the symptoms are related to pain related to activity, pain at night. Majority of my patients are, the most common symptom is difficulty to sleep at night. Swelling, the swelling is associated because there is inflammation in the joint, there is deformity associated with it, and stiffness. These are the main features of arthritis. Now, if you look as such, specifically as a hip joint, it has got a lot of motions in that. So you can imagine that arthritis is simple wear and tear of a joint. And if you had a car with 40-year-old car, the things will start wear up a little bit here and there. I'm not saying 40 is old, I am 40. So the main advice I give to patients is weight loss, because a normal joint, when it is loaded, takes 6 to 7 times the body weight. So you can imagine it is not how much you weigh, it is how much you can lose. It is a multiplication factor. The second is activity modification, and the most important aspect is physiotherapy. And John, you probably know much better than me about physiotherapy.
So John, how does physio help to control the symptoms of arthritis?
Thank you, Susie. The key thing to physiotherapy is always to remember that everyone is different. The severity of your hip OA, your fitness level, your age will play a huge role in how we want to manage it. But the key thing for you to do is listen to your body, okay? During periods of lockdown, we want to be making sure that we're moving little and often, keeping some flexibility, and using the motion that's there and always as pain allows. Optimally, we look for a tailored physiotherapy assessment, followed by the intervention of specific exercises tailored to you. But mainly, our main goal is to maintain flexibility, strength, and the optimization of loading and posture.
Lovely. So, John, have you got a couple of exercises that you could show us?
Absolutely, certainly. So the first exercise I'm going to show you, which will be good for hip arthritis, but also pre-operatively. So they're going to help to make sure you maintain flexibility, which will give you better outcomes post-surgery also. So the first thing we're going to look at is some flexibility exercises. Number one, we're going to look at is hip flexion, bringing the knee up towards the chest. Make sure you're holding on nicely to a table, chair, something along those lines, nice and supported. We're going to bring that knee up towards the chest. Going through a range of movement that's comfortable for yourself, looking at approximately 10 repetitions. What I then want you would then suggest to say is we want to look at moving the leg out to the side. Again, making sure you're nice and supported, nice and stable. We're going to take that leg through a movement to the side, a movement that we call abduction. Looking just to try to, again, maintain nice flexibility through that range, approximately 10 repetitions. The final exercise for flexibility, which is very effective for optimizing walking, is extension. So what we want to do, nicely supported, bringing the leg out behind, maintaining that flexibility, maintaining a nice stable pelvis, and bringing back and forth. They're the flexibility exercises which will be very good to maintain motion at this time.
So, John, a good percentage of my patients have got issues with strength. So the common symptom they present is that the hip is so weak that sometimes they feel that the hip is going to collapse. So could you give us some exercises for those, for strengthening the hip joint, please?
Absolutely, no problems at all. So the strengthening exercises I would look to do vary from one person to the other significantly. But some very nice exercises. Number one will be a simple sit to stand exercise. Find yourself a bed or chair position that's comfortable for you. You can raise or lower that depending on your abilities. What we'll then look to do is a nice sit down and a stand up, using your quad muscles and the glute muscles at the back of your hips, coming up and down. Look for nice controlled motion, approximately 10 repetitions. You can use your hands if you find difficulty getting up and down to make it easier, getting nice strength. Also, to make sure we're strengthening the glutes nicely, we can look at a bridging exercise. I'll take a small lie down here. And as I lay down, what we're looking to do then is lifting your bottom off the bed, getting nice activation of your buttock muscles. Again, a nice 10 repetition is excellent. That can work very nicely to maintain some general hip strength.
John, other question during this lockdown, I think I'm quite keen that the patients with hip arthritis are up and about, walking outside, having the fresh air, which is quite good for physical and mental health. So the normal question that is asked to me is that, do I use a stick? If I use a stick, which side do I use? Do you have any advice for that?
Absolutely. And what I would say is the most important thing as we're loading the hip is as symptoms allow. And what we want to make sure is we can maintain a good level of mobility and activity to keep heart, lungs, mind healthy. So what we want to think about is using a stick or a crutch as you feel comfortable. I would use it on the opposite side to the affected leg. Okay. So we can then make sure that we're actually able to take a load off the affected side, which will work very nicely. What we also want to think about is making sure that generally you are also keeping nice load over the pelvis, keeping it nice and square, and making sure the spine is staying nice and neutral above that. But what you're then looking to do is use the crutch and maintain as normal a walking pattern as possible.
You'd be surprised. That's a very common question about left and which side the stick or the crutch should be used. That's excellent advice, John. Thank you. So, Susie, carrying on from there, I think these advices are excellent for patients who are waiting for surgery also, because it helps in the rehabilitation. Now, majority of the hip arthritis can be treated, as said, from activity modification, weight loss, excellent physiotherapy, and pain management. Now, if the pain is not controlled by that, then we go into hip replacement surgeries. I'm afraid, Susie, that is a big topic of its own, but hip replacement surgery is a very successful surgery, and it is one of the surgeries which allows you to have 95% success rate. Majority of my patients would forget which hip was done in a year's time, in terms of they are fully back to activities of what they want to do, and it also increases their lifestyle, their mental health, and also the other comorbidities like that helps decrease diabetes, hypertension, because they're active.
So thank you both for joining today. We really want to support during this time. So I'm sure both Mr. Unithan and John would be more than happy for conversations over the phone with no obligation to yourselves. So we're here to help. Please do get in touch with us if you need us. You can contact either our Surrey Total Health website, which will be showing up on the screen, or you can call us on 0800 160 1232. And also the Body Mechanics website will be showing up here now as well. Thank you.